This meeting is being recorded.
Okay, so just four screens there. Right, so it's been sort of a busy week, I know, in our own service, but if we can go around and see what's been going on. I'll just go by my screen. I know people's screens tend to vary, but I've got in my top left, I've got Claire Arthur. Morning, Claire. So I want to just let us know what's been going on.
Yeah, sure. Yes, it's I think, as you just alluded to, it just feels absolutely crazily busy at the moment in the hospital. You know, I'd say referrals are probably higher than ever. Well, they are, and that means sort of drop-ins and holistic needs assessments are fairly consistent, but referrals from the clinical team, and those are quite complex, more complex than ever before. So really been feeling that. But I'd like to introduce Caroline to you. Can you see on the screen? Caroline is our new support worker and has joined the team. That's my fourth week. Can't believe that. And it's absolutely amazing to have her. So that will make life so much better in Worcester. So we hope to have 2 pods open when Caroline's finished all her induction, and we're also looking at bringing some volunteers back once Caroline is fully up to speed, which is great. So you know, some of that's the motions that are in process. We've been speaking to Matt Millen about trying to update the actual pod itself, because the one in the atrium, I'm sure many of you know, it's quite open, it's quite noisy. We have visitations from cats and birds, and as well as patients. It's quite a challenge sometimes to hear a patient speak. So we've been speaking to Matt Millen about perhaps what we can do about that. The difficulties is that because it's a PFI, it's not as easy to get agreements through in terms of health and safety and cost, etc. So it has been a slow process, but you know, the pod that we hope to get is not going to happen for those reasons, but we are hoping that we will have something that is better and upgraded. So that's quite exciting. And signage is in process, and some bits and pieces to improve the oncology pod, so that people are more aware of where we're based, what we're up to, and obviously having Caroline here and some volunteers coming back, it will enable us to cope better and help and do more. So that's all exciting. So yeah, I think that's us really. Yeah, so we're onwards and upwards, keeping our heads above water, just about.
It's obviously because when you get an upturn in inquiries, we do as well. So yeah, so yeah, obviously closely linked there. But good to see you've got colleagues down now to.
Yes, it's fab. And I think, as Sally and I said the other day, with having Caroline able to man one of the pods shortly, that will have a knock-on effect again for referrals, which will have a knock-on for CAB. So we're all very aware of that. So yeah, that might be food for thought for all of us, really.
Just funny, because we were talking have you had about referrals, obviously we're trying our internal sources. Have you had any progress on that? It's probably not for this forum, but any news on
we're emailing all of them at the moment. We'll talk to Lisa Mowbray about the data.
Yeah, okay.
Yeah, but Ange and I and Kim are emailing. I think we had an agreement that because for our volunteers,
work in progress, and lovely.
It is, but yeah, we'll keep at it.
Yeah, no, I know big organisations, it takes a lot to get things through. Thanks a lot. All right, so I've got Ange and Angela, can you introduce yourself and give us a little update as well?
Yeah, hi everybody, I'm Ange Gillett. I'm the Macmillan Information and Support Lead for the north of the county. So I cover the Alexandra hospitals and Kidderminster hospitals. Apologies from my support worker Kim, she's at an event at Primrose Hospice today, but she sends her regards. Very much just adding on to what Claire said, I think we've all kind of come to a realization that we're hitting some sort of, I don't know, peak post-pandemic of really poorly complex patients. And it's you know, I think we're all very conscious of the massive impact, you know, CAB are playing in terms of helping these poorly patients who literally are going to, you know, SR1 forms from diagnosis. So, you know, that's a huge thing for us all to get our heads around. It's very different to how it was pre-pandemic. And as Claire quite rightly said, having Caroline and Kim has in effect doubled our, you know, our referral levels to you. And actually my volunteer's just been outside with somebody and that's generated another referral. So it is really, really, really just really busy. I mean, thank goodness we're all here is all I can say, but you know, we are very conscious of how many emails we send to Sally and Ange a day, and how horrible it is to just receive that in an email, you know, this potted history of really sad things. So I think we're all very conscious of that, aren't we?
Yeah, I think this sustained level of high of a peak really, you know, we need to get to the point where, I mean, we are working to capacity, but at some point there needs to be a question about additional resources. I mean, I've got a meeting at the start of next month with Tudor Williams, and that might be a starting point, but you know, that in itself brings additional complications with you know, role expectations and targets and things like that. But we're at the point now where if you've got people that we can't actually offer the service to properly, then yeah, we need to be having a conversation upwards with Macmillan. Yeah, okay. Thanks.
I think we, you know, the way we measure our stats is we had a big team meeting yesterday, and I think, you know, the data reporting we do for Macmillan, the evidence is all there. It's overwhelming, you know, it's there in black and white.
I think we'd have to go at it from all angles, from your service, our service, you know, just with the stats to you know, are they going to stump up, you know, where we can justify that need. Okay, thanks, Ange. I'm going around. I can see Teresa there. How are you, Teresa?
I'm good, thank you.
Yeah, yeah. For those that perhaps haven't, I think might be a couple.
Yeah, I'm the benefits caseworker in the north of Worcestershire. I'm only part-time now, and I only work from home. I only work 2 days a week. Yeah, so I was full-time, but then due to my own health issues, I had to sort of reduce what I was doing. But they are keeping me busy, and like both Ange and Claire have said, there's a lot of complex and a lot of SR1s now coming through to us, and yeah, it's really sad, really sad. So yeah.
Are there any particular issues you're finding at all, or is it a range of things?
It's a range of things, and then obviously there's the decisions that are being made by the benefits that aren't special rules that are winning anyway. So I just think to put somebody through all of that, and to get that at the end, I just think, what's going wrong? What's going, you know, wrong with that? Because
if a medical practitioner has said it, you know, issued the certificate, it shouldn't be questioned, really, should it?
No, and it's just under normal rules as well, whereby the patients have filled out done everything, filled out the form, and then the DWP have made a negative decision, and then we're taking it to appeal and they're winning their appeals. And I just think, did we really need to put them through all of that?
Yeah, I know our benefits appeals caseworker, it's something like 85% of the appeals, the decision gets overturned. It's ridiculous. So yeah, that's something Citizens Advice have taken forward with their research and campaigns arm. So whether or not we'll make any progress, but yeah, it's always worth it. If you see one of those, put a tag on there for our research and campaigns team so they more national level. Yeah, all right, thanks, Teresa. I can see on my screen next is Chris Byrne. Morning.
Hi everybody, good morning. Chris Byrne here from Healthwatch Worcestershire. I think probably what I'd like to do is to invite you all to our annual conference. I don't know whether you've seen the advert for it, but it's on Friday the 30th of June, 10 o'clock until 12:30. You'll hear about our annual report, obviously opportunity for networking. You'll be able to influence the business plan that we're putting together. In fact, that's particularly my job. So we've got a long list of potential areas that we want to focus on. So there'll be an opportunity to have a bit of input into that. What I'll do is I'll put the link into the chat so you can book your place. So if that's okay, can I do that?
Yeah, lovely.
Yeah, I'll do that. Yeah, so we'd like some as many people as possible from across the health economy in Worcestershire to come along and help us with what we do at Healthwatch Worcestershire. Thank you.
Oh, that's great. Thank you for the invitation, Chris. So, right, Sally, I've got you next on my screen. If you want to give us a little summary of what's been going on.
Sorry, can you hear me now, Sonia?
Yeah, that's it. Yeah, we've got you. Yeah.
Sorry, I was just trying to help someone who's trying to get on the meeting, but hasn't been able to, so I got a bit distracted. Sorry. I think Claire and Ange have said it all. I mean, we've been consistently really busy for ages, but the last month has been, if it's humanly possible, a massive increase in referrals, particularly from hospital, whether it's through the Macmillan service or clinical nurses. It is incredibly sad because there's so many late diagnoses. You read the certificate that we get, and that, you know, date of diagnosis is the date that it becomes a life limiting prognosis. So it is very sad. Can't really say very much more about it, just to acknowledge how incredibly relentless and hard work it is for everyone. The only other thing to say was from Kate, who's also works for North Worcestershire, so it's the same role as Teresa. One of the trends that Kate has noticed has been that Universal Credit have been contacting terminally ill clients about going back to work. And what's not happening there, Andrew and Teresa will be able to say more, is that their work coaches should be contacting them when clients start chemo so that they get the proper assessments, and that's not happening. And so there's delays in payments. So it's just something she's picked up because it's happening several times. And she said there's also delays with peer pound attendance allowance payments, even where there's an SR1, which is where there's a time limited prognosis in place. So lots of different challenges from different angles.
And I kind of think, you know, we think about what's happening with us, but this will be replicated in every single trust in the country. And I just think, how on earth are the DWP going to cope with this absolute onslaught now? And clearly they're not, from what you've just said. But it's heartbreaking to think that people are being contacted so inappropriately.
Yeah.
Yeah, I'm not surprised to hear it, but sad all the same.
We need to make sure that Kate knows how to feed those cases up to our research and campaigns team. Sally, I don't know if she's aware of that process, but
It does. It's just a question of time doing it.
No, exactly. Well, no, I mean, it's putting a tag on this. You don't have to write it up. Our research and campaigns team would do it. Yeah, but I think as well, Sally was saying that since the old process of DS 1500 for a life limited prognosis has gone to SR1, you've seen more, I think, possibly because it's now 12 months instead of 6 months. The medical practitioners are more confident to issue the certificate now. I don't know what you, Claire and Ange, you finding that as well?
I think it was really helpful for Andrew to do. He very kindly did a little presentation to the CNSs, which I think really helped with their confidence in terms of, you know, basically saying, you know, somebody could live for 3 years after that SR1, but it's you know, your best judgment. Nobody's got a crystal ball, and I think it really helped Andrew to make them a little bit, you know, less worried about doing that. Do you agree, Claire?
Absolutely, that's really, really helpful. Yeah, we have got some CNSs who are a little more reluctant, let's put it that way, than others. So that was really helpful and very, very clear as ever from Andrew. So yeah, great.
I suppose there will be higher numbers qualifying, so I guess that's the impact as well, because now, you know, the prognosis period is 12 months. You know, more people are going to be in that category, so we're going to see a larger number coming through on that. So that's another thing we need to let Macmillan know resource-wise as well. Yeah, okay. Thank you very much, Sally. Ben, you're next on my circuit.
Morning, everyone. Can you hear me okay?
Yeah.
Morning, everyone. I think I know most of you, but I'll introduce anyway. Ben Furlow, I'm the Macmillan Living With and Beyond Cancer project manager working across Worcestershire. So I work alongside Claire, Ange, and Claire, Caroline, and Kim. Yeah, just to echo what Claire and Ange have said, very lucky to have Caroline with us now, which is great support. As Ange and Claire have both said, they're inundated, as you've all said. It's just very busy at the moment. So Sonia, coming on to your point about data, it's actually something we discussed yesterday in our team meeting. I'm looking to pilot electronic HNAs within our breast unit. Now, while this may increase referrals, apologies, the good thing about it is the data that comes out the back end of it is really good in terms of drilling down to exactly what patients are putting on their eHNAs. So with that, the plan would be, and my thought with eHNAs has been all along, is it gives us really good evidence to take back to Macmillan to show these are what our patients are coming to us in distress with. We need to make sure we've got the right mechanism support in place in the community, in the hospitals, to make sure they're given the correct support at the right time. So in terms of data, it's really exciting, I think, certainly from my point of view, because I do like a bit of data, in order to evidence all the good work you all do, but also to show how stretched the services are. So if there's anything you want to support with around data, I'm more than happy to help with that, working with yourselves and obviously Claire and Ange in the pods, just so we can sort of more do a full bid, I think, to Macmillan to try and make sure we've got the support, because it might be that we need another support worker here at the hospital, which means that could help in seeing patients, which could in turn potentially reduce referrals to yourselves. But then we could also say, well, we need the support in your area. So it's finding out it's seeing the bigger picture, I think, and I think that's what we need to be sort of really mindful of in everything that we do, is to making sure we've got that evidence to go back to Macmillan to make sure that we've got the support in the right place at the right times for patients.
Yeah, no, I think that'd be excellent, Ben. The more sort of any case we put has got to be kind of evidence-based. So yeah,
absolutely.
Brilliant. When we start to put something together, I'll contact you and see what you've got Yeah, brilliant. Thanks, Ben.
Yeah,
That's
more than happy to help. So other things, just to give you everyone a quick update on, we've got our next Health and Wellbeing Day in 13th of July over at Wolverley. Andrew has very kindly agreed to come along for the morning, which I think is really good for patients. It just gives patients an opportunity to go and speak to Andrew and see what support you guys can offer, but also give, if Andrew, if you're okay to bring some sort of reading material that the patients can take away with them as well, because there might be things that they just don't. It's hard to know with these events what patients we're going to get through the doors. It might be they've not even touched sort of the Macmillan pods or a HNA, so they're not really aware of what's out there for patients, which is why it's good to have these sort of events and people like Andrew there to sort of and highlight the services available to them. Obviously, the app is still going forward that I shared with you all before. The engagement we're getting from patients is really good. The content's building all the time. So if there's anything from your sort of area, Sonia, Teresa, Sally, same goes for you as well, Chris, that you think would be useful to go on the app for patients, that, and also feel free to direct them to the app as well. Did I send you the leaflet, Sonia? I feel like I did send it around the group, but I don't know whether I've sent you the latest one.
probably not the latest one. I think we saw an early draft, so maybe if it's been updated.
If I send you the latest one, what you can do is you can email that to patients. It's a very simple sort of QR code and download instructions, and then that might help, because it signposts to your information, but also other things like the Macmillan ebooks, the Macmillan hubs, support around sort of well-being, meditation, support groups, Health Watch on there as well. So I think it's a really good tool for patients because it keeps it all in one area. So I'll send you the updated leaflet for that for patients. I'll also copy you in. Is Chris still on the call? Sorry, I can't see everyone on my screen. I'll copy it into you, Chris, as well, so you can share it with patients as well. I can't make the your AGM, unfortunately. It would have been good to get there, but hopefully one of my colleagues can attend. But I'm happy to send you some blurb, Chris, to share with patients as well, because that'd be really useful. So I'll happily catch up with you after the AGM, Chris, if I can. That'd be good.
Yeah. No problem.
I think that's it from me. Yeah, I think that's it. Thank you.
No, I think that your app sounds, but yeah, we definitely need to get your app promoted. That's a really useful tool. So thanks for that. We'll do that. Thank you, Ben.
Thank you. Thanks, Sonia.
Sonia, sorry, there's someone in the waiting room. Sharon?
No, I'm here. I'm
Okay.
actually in, yes. I was struggling to get in, but now I'm here. Yeah, thank you.
Okay. Andrew, I've got you next on the circle.
Yeah, so I'm Andrew and I am one of the Macmillan Benefits Advisors. I generally cover South Worcestershire. I think probably I know most all of you already. Yes, really just what Claire and Ange and Sally and Teresa have said. It's just very busy, and all the cases are less simple than they used to be. It seems that when we'd used to be, a good chunk of the cases were all just sort of simple benefit checks. It's very rare to get just a simple benefits check now. It's always plus a Macmillan grant or plus a blue badge. You know, people seem to want or need more complicated help now, I think. And yes, just staying very busy. Yeah, and there's not much way around it really. They keep coming in and we keep seeing them, so just doing that as much as we can. Yeah,
appreciate that, Andrew. Yeah, and you know, I think last month was a particular peak, so you know, we'll just have to, as I say, bring this up in our various line management or project managers, Macmillan project managers, and yeah, just let them know what's happening on the ground. Yeah, okay, thank you, Andrew. I've got, oh yeah, t'other Claire, but the screen is blank, so I don't know whether.
Hi, yeah, it's me. Sorry,
Yeah.
my laptop's not smart enough to have a screen and a speaker at the same time. So I'm Claire. I'm the Macmillan Living with and Beyond Cancer CNS for Worcester Acute. Just following on from what my team have said, really, some of the HNAs that are coming through now are really quite complex, and as Andrew said, are kind of triggering the SR ones a little bit bit quicker. So I just think with the full complement of team that we have now, hopefully reaching out to more of the chemo units, and with the health and wellbeing event coming up, I do think referrals probably are going to keep going up, as well as the backlogs. I mean, we sit in the cancer services and we can hear all the amounts that are going through the systems, and breaches that are like late reviews and things. So I think it's just going to be a more and more complex needs when we do see these patients. So I can't see anything changing anytime soon. And just literally as the rest of my team have said. So yeah, lots are happening, I think.
Obviously, well, from your team's point of view, do you think that our patients getting to the primary care? I mean, are the referrals, to cancer specialists, are they now coming a bit more timely, or is it still a backlog from the pandemic? What would you, have you got sort of a view on that?
I haven't. I can ask the team I sit within. I mean, we all know that people can't really get in with GPs, and just hearing some of the conversations within the departments that people are presenting late, whether that's GP backlogs or just delaying presentation from themselves, I don't know. But what I do seem to be seeing is a lot of more complex needs at presentation. So I think it probably is almost like a worsening situation, as well as a knock-on from COVID. So I can't see anything changing really anytime soon.
Yeah, it's all a bit anecdotal, isn't it? We can't be sure if people are now seeing primary care on time, or whether we've still got a black. So it'd be interesting if we could sort of find out a little bit more about that, so we might know what's down the road for us a little bit, but I'm not sure who we would approach to get that sort of picture. But yeah, okay. All right, well, thanks for that, Claire. Yeah, it was
No
busy.
problem.
Sonia, sorry, can I just interrupt a minute? Claire and I actually have a meeting with a PCN cancer care coordinator tomorrow, who obviously works within the one of the Wyre Forest PCNs. So if there's anything that you think would be useful for us to ask of primary care, we're more than happy to do that. We're going to sort of see how we can, Claire set the meeting up to see how we can work sort of collaboratively with them. I've met with one of the cancer care coordinators in South Worcestershire PCN. So in terms of what they're doing, so if there's anything that you want us to ask, drop us an email later today and we'll happily
I'll pop you a message later today. Probably just a couple of questions if we know what's coming through and what's going to filter, that kind of thing. But I'll try and formulate what I think might happen and send that. Thank you.
We're happy to raise that tomorrow about the sort of the questions that you've already flagged. But if there's anything else, or if anyone else has got any other questions for
fabulous,
we can direct it at primary care, let us know.
Okay, wonderful. Okay. So Sharon, welcome, and I'd like to sort of introduce and just give us an update of what you're doing.
Hi Ben. I did meet with yourself a couple of months ago. I don't know whether you were referring to me. I'm from South Worcestershire PCN. I'm cancer care coordinator, the only one.
Sorry, Sharon, I didn't see you on the call.
That's okay. So the thing is with my position, I am literally the only cancer care coordinator for 130,000 patients citywide. So unfortunately, I have not been able to put the support out there that I initially thought that I would be doing, because it's just going to be too overwhelming. I won't be able to support patients in the way I really wanted to. However, I did have a referral from a GP to see a gentleman who would like some support, and I'm happy to take those type of referrals that come through my emails, but I couldn't sort of put out a service because it's just too much, unfortunately. We are looking at recruiting another cancer care coordinator for Worcester City, and hopefully that will come to fruition and we'll be able to provide that service to individual patients. But at the moment, we're focusing on cancer awareness for early detection and prevention. So the NHS long-term plan to get cancer diagnosed at an earlier stage. So rather 1 and 2 rather than 3 and 4. So what I've done from the outset, I've been making sure that all our practices, so we have 10 practices in total, making sure that they've all got hard copy information on cancer within their waiting area, easy read information, and information in different languages as well. The big project we are doing at the moment is providing drop-in cervical screening clinics. We've been doing that during GP extended hours. However, to support Cervical Screening Awareness Week, we're holding clinics all next week at St Martin's Gate Surgery in Worcester. So that's from 8 AM to 6:10 PM from the 19th to the 23rd of June. So we've got a team of nurses who, and I will be supporting them to do that as well. So that's next week, who will be doing the drop-in cervical screening clinics.
Sharon, sorry to interrupt.
Yeah.
Can I just ask on that? What's the comms that's gone out for that to let patients aware? Do you know?
It's been advertised on Facebook. I've got posters all over the city, which I distributed myself last week. I've also got posters here that I'm going to be putting into the practices this afternoon. It's on Instagram as well. And I think we now have somebody within the PCN who is doing all these comms. So I couldn't tell you more than that, but I know he's been reaching out quite widely, which is great. It's what we need. Is there anything that you can suggest we do in addition?
Well, I was just thinking you could, if you want to send the details over to me, we can probably print some stuff off. I don't know. I haven't seen anything in the hospital. Claire and Ange might be able to say. But if we could get in contact with our CNSs in Gynae, and then I could also put an alert out through the app as well.
We can stick it on our Facebook.
Yeah.
The thing is with it, there is a restriction. These patients need to have a Worcester City GP, and they need to have had a letter to say they are due for their screening.
Right, okay,
that's the thing.
Okay.
So yeah.
But
you can still do it.
Drop in with, yeah. Okay, fine.
Yeah, they have to be registered with one of the Worcester City GPs.
Okay. If you can send me the comms information, and then I'll speak to Peter and our comms team. And it's probably best to go through that rather than me just pinging it out randomly.
Yeah,
that's probably the best bet.
Yeah, I'll send you all the details, and so you can ping that out as it is. But yeah, thank you very much.
Okay, cheers. Thanks, Sam.
Sharon, it would be really useful if perhaps we could touch base at some point. I don't know, a quick meetup just to share contacts and what each other are doing, and of course, as we're both south, that'd be really useful.
Okay, so you Claire Arthur?
I am all day.
Right. And do you have an email address?
Yeah, it's Claire without an I. clary.arthur@nhs.net.
Okay, as soon as this meeting's finished, I'll send you an email, and then we can start to have conversations. Yeah, thank you. So I'll just go back to what I've been working on. So yeah, it's a lot to do with cervical screening. Also, I've been working in conjunction with Prostate Cancer UK as well. We've been sending text messages out to those patients who are most at risk. So those age 45 to the age of, I think it's 70 or 75, who are from an ethnic minority background or have a history of prostate cancer in the family. So that's what I did. I was sending them text messages, and the ones who don't have a mobile, I was calling them to invite them to come in for a PSA blood test, which is supported by our HCAs within the PCN. There's lots of information out there as well that we gave to people about these blood tests, and the response was pretty good. I'd say out of about 390 messages, we probably had about 90 people book in for blood tests, so that was quite positive. Also, we're going to be attending again in conjunction with Prostate Cancer UK, the County Championships events at Worcester County Cricket Club, and we're going to have a stand there, and we're going to be talking to men about the signs and symptoms of prostate cancer. We're working closely with West Mercia Police to provide screening information and cancer awareness to them. and we plan to work with Worcester Racecourse as well to provide a similar service. We've been working on the bowel screening. So again, I've been texting or calling non-responders to the National Bowel Screening Campaign, giving advice and information on the home testing kit and breaking down barriers to screening, signposting them to the national screening place. And yeah, just smaller things, so to visiting community settings such as St Peter's Baptist Church and Worcester Community Trust to talk to local groups. And then we have a project starting with our lifestyle advisors, health and wellbeing and social prescribers within the PCN to support local armed forces groups as well. So again, health and wellbeing information and cancer awareness information. So yeah, that's what the Worcester City PCN have been doing. I started my role 8 months ago, and it's a difficult one because there are so many aspects of this role. It can go in any direction. It's huge, and covering 130,000 people is just huge within itself for one person. So we try and sort of reach as many people as we can. And again, it's working out what are the big wins really. But yeah, it's all very exciting, and I love what I do. I used to work at St Roger's Hospice, by the way. I worked there for 3 years, so that gives me that drive to sort of support people for early diagnosis and prevention.
Sharon, my volunteer has just said local radio is really, really useful for getting that message out that you're going to be at certain events.
Yes, okay. Yes, I think we might have contacted them, but I'll speak to my colleague this afternoon.
Which radio do you need?
Yeah, I know we've contacted the local newspaper. So
yeah, it's a quick win.
Gosh, thank you, Sharon. You have a very busy role for one person. Yeah.
Yeah.
Okay, thanks for your
thank
update.
you.
Welcome to our forum. Yeah. Okay. We're nearly there. There's one person I'm not quite sure. It's almost like SOCS. Who's that?
Hi Sonia, it's Angela Patterson. It's how I link. Hi, it's how I link into Zoom. Unfortunately, it won't do it any other way. So I'll just explain briefly who I am. I'm Angela Patterson. I'm the Macmillan Welfare Rights Unit Manager. I sit on the periphery of Worcester really because I manage a team based in New Cross Hospital in Wolverhampton and a team that, well, 2 teams that are based in the Shropshire region of Royal Shrewsbury and Telford Hospital, delivering benefits advice. I mean, from our point of view, really, we're exactly the same as you guys. We're inundated with referrals. SR1s have shot through the roof, which is very, very sad. And I think the really sad part for us is we're seeing a lot of young people coming through with SR1s for some reason. I'm not quite sure why. We do, from a PCN point of view, we do already receive referrals in Shropshire from the PCNs. At the moment, there's about 6 or 7 PCNs in post in Shropshire. And I would say around about 15% of our referrals every week come in from the PCN cancer care coordinators, if you're looking for some sort of impact that they may have, depending on how many you've got. So we do work very, very closely with them. But yeah, we've recently managed to secure some additional funding. So we have got a new person in post, welfare rights officer, who straddles both areas. But I'll be honest with you, that took a lot of recruitment to get the right person. But yeah, he's hit the ground running. So fingers crossed, once he's done his induction, we'll be up and running a little bit more. But we do have a backlog, and it's just the nature of the game, unfortunately, at this moment in time.
Thank you. Yeah, it takes a while to get up. I was glad to hear there's some more resourcing in the pot there as well to dealing with these referrals. It's as a team, I think we've all saying the same thing. So yeah, it's doing what we can to support each other through it, really, isn't it? Okay. So I think we've had an update from everybody in the meeting. Just really, I'll circulate the link for the recording if you've got colleagues that couldn't make it or want to just review something. Just ideally set the date for the next one. Then I looked at the calendar for, or Sally rather. calendar, what's the next date that we would be heading for?
Sometime in September, Sonia, I think. Either Tuesday or Wednesday.
Yeah, Wednesday, probably do a Wednesday next time in case the Wednesdays are better than others for some. Where are we? 1, 2, 3. Are we talking about quarterly? So that's oh, hang on, I can't get my calendar up. Anybody got a calendar up for me?
How about the 13th of September, Wednesday the 13th?
Yeah, let's go with that then. Yeah. Right. Fantastic, Paul. So lovely to see you. Ben, I'll drop you a line as well. And yeah, enjoy the summer. So it's been as we speak before. All right, take care then. Bye.
Thank you.
Cheers. Thanks everyone.
Bye.
Bye.
Bye.